So I'm Chris Holmes. I'm the Director of Supply Chain for NHS Supply Chain. I've been in this role for just over 2 years now. Prior to that, I've spent around 20 years in the NHS in various procurement and supply chain roles. Previous to that, I spent 9 years in manufacturing in the private sector. NHS Supply Chain is a primary supplier of consumable products to the English and the Welsh NHS. We cover anything from food all the way through to medical technologies, including MRI scanners, CT scanners, so a whole range of different products. NHS Supply Chain is, in my opinion, is vitally important to the NHS. We provide, in some of those category areas, we are the principal supplier with significant market share, and overall we are around about 55% of all products in the categories that we support are supplied into the NHS via NHS Supply Chain. And one of our key aims is to ensure that we can drive that further by driving greater value for the NHS by increasing that market share upwards to 80% and beyond. COVID has been very, very challenging for everybody involved. The NHS has done an absolutely amazing job in supporting patients and delivering first-class care. For NHS Supply Chain, we've played a small part in that. We're very proud to play our part in that. It's been incredibly challenging. There's been no playbook for this type of pandemic. Clearly, it was a global pandemic as well, which made it even more challenging in terms of obtaining supply that we could then provide into the NHS. So the biggest challenges and the biggest lessons to learn are around how do you prepare and how do you equip yourselves for this type of pandemic in the future. We've learned lessons and we're looking at how we can put those into play both in the near term, because COVID is still with us, and also in the longer term as we look to return to a business as usual or a new normal. So from a COVID perspective, we are working with other government organisations to ensure that we understand what the planning assumptions are, and we've got product in place and we've got services in place to help meet those planning assumptions as we move into the winter months. We're also obviously very aware that the NHS is trying to get back to a new normal and reintroduce services that have not been able to be operated whilst it's been in COVID. So we're also working to ensure that those products and the supply chain of those products is strengthened so that the NHS can have confidence that when they step in and step up those services, the NHS Supply Chain is going to be able to deliver for them. We're working very closely with a number of agencies, so the Department of Health and Social Care, Public Health England, NHS England and NHS Improvement. Also with our supply partners and our service partners who make up the model that is NHS Supply Chain. We're working very, very closely with our customer colleagues in the NHS. Our customer engagement team are working with them on a daily basis to understand what it is that they're doing to try and introduce services back into their operations and what their plans are and how we can support their plans for obviously the winter pressures that are coming, and also as we work towards the end of transition period as well in January. So as part of our transformation programme, we've been working to ensure that we can improve our logistics infrastructure. Bury St Edmunds is the first part of that programme. We took a decision a little while ago to actually invest in that area. We currently have a site in Bury St Edmunds, but it's a site that's been underinvested for a number of years. So what we've done is we've opened a new purpose-built facility referred to as Suffolk Park. It's almost twice the size of the previous site, and all of the staff that were working in the old Bury St Edmunds site have now all transferred across to the new site. That happened during COVID, so the plan was to open that site in May this year. It opened in May this year, so an incredible amount of work that went into that from the team. That was particularly important to make sure that we did open it on time so it could actually support the COVID response. The facility is fully MDR compliant, so that's the medical device regulations, and that's really, really important because it's those regulations that ensure that we can, with confidence, have our customers order from us and know that those products have been stored in accordance with the manufacturer's conditions, any temperature conditions, both in storage and in distribution. And that's across the whole of our NHS supply chain network, not just our Suffolk Park site. So our technology transformation is often referred to as the Core Technology Refresh Programme, CTRP. That's how some of our customers may know it. That activity is still very much underway. There's two main aspects that we're working on at the moment. One of them relates to eDirect, which is a supply channel within our network, which allows us to have products delivered direct from suppliers to customers. We've had feedback from customers about areas of that solution that need to be looked at and improved, and we're working through that now. So that's one of the first things that will be brought to our customers in the non-too-distant future. Another part of the CTRP, which is very much part of the supply chain element, is a replacement of our warehouse management system. So our current warehouse management system, which is called Resus, it's very old, it's very solid, but it doesn't have the flexibility to offer those new types of services that we know our customers want now, but also in the future to ensure that it's future-proofed. So what we are doing is we're moving to a new Oracle cloud-based solution. The system is being developed, and the first site that we're going to roll that out to is in Bridgewater, and the first site will get implemented in 2021. The key benefits for the customer are really about ensuring that they have a better experience when they're actually ordering from us. It's simpler, but they can have the confidence that when they place their orders with us that we've got the right technology to be able to deliver to them, and they've got the confidence that products are going to turn up when they require. The other part to it is about those building upon those service requirements. So ensuring that if customers in the future need different types of service levels, different types of lead times for certain products as things change, that we've got the capability within our solutions to deliver that. COVID will continue to be a priority through the winter months, and we'll work with the government departments to ensure that we're prepared for that. We're also working with the Department of Health and Social Care on end of transition planning and ensuring again that we've got supply chain resilience built in the event of any disruption. We're working with our tower partners to ensure that they continue to look at the category and sourcing strategies and putting new frameworks and new contracts in place for the NHS. Our towers are here exhibiting today virtually, of course. One of our big priorities is our sustainable development strategy. The strategy's got 4 key pillars towards it. It's improve human rights and labour standards, waste and the circular economy, reduce plastic products and packaging, and reduce greenhouse gas emissions. That's clearly going to be a big thing for our supply chain, and that will feature in our category strategies, our sourcing strategies, and also our logistics activity as we move forward. This year's been an incredibly challenging year for everybody within the NHS, and I'd like to thank the NHS for all of the tireless work and first-class patient care that they've given. Our supply partners have been a huge part of the work that we've been doing, and have worked tirelessly to ensure that the NHS has got the products that it needs to provide those services. Our service partners who form NHS Supply Chain, again, have worked incredibly hard and done a fantastic job in trying to ensure that the NHS has got what it needs when it needs it. So I'm very proud to be a very small part of that. We will continue to work with our NHS customers to ensure that they continue to get the products and services that they need and deliver the fantastic patient care that they've been doing.